Did you know that endometriosis impacts 190 million women worldwide? In the United States, it affects over 10 million women and is often underdiagnosed due to its variable symptoms. But what exactly causes this painful and life-altering disorder? Endometriosis is a medical condition where tissue identical to the lining of the uterus grows outside the uterus in areas where it shouldn't be. This misplaced tissue can be seen on the ovaries, fallopian tubes, the outer surface of the uterus, the pelvic lining, or, in rare cases, other organs like the intestines or bladder. In this video, we're diving deep into the lesser-known triggers of endometriosis, exploring the critical role of immune dysfunction, hormonal imbalances, surgical scar complications, and more. By the end, you'll not only understand the complex factors behind this condition, but also gain valuable insights into its symptoms and potential causes. So what are the symptoms? Number 1. Pelvic pain. It's one of the common symptoms of endometriosis, often displaying as a chronic, debilitating ache or sharp stabbing sensation that profoundly affects a woman's quality of life. This pain usually arises in the lower abdomen or pelvis, but its intensity and frequency can vary widely. It often worsens during menstruation, but many women experience persistent pain throughout their cycle. The discomfort arises from the inflammation caused by endometrial-like tissue growing outside the uterus, which triggers the release of inflammatory chemicals and causes scarring and adhesions between organs. Pain during intercourse and bowel movements or urination is also common when endometriosis affects the bowel or bladder. Pelvic pain is not only physical, but can also take a toll emotionally, contributing to fatigue, anxiety, and depression, as women often endure years of misdiagnosis or ineffective treatments. Number 2. Pain during intercourse. It's also known as dyspareunia and a common and distressing symptom of endometriosis, affecting many women who suffer from this condition. This pain typically occurs during deep penetration and can linger afterward, ranging from mild discomfort to severe debilitating pain. It is caused by the development of endometrial-like tissue on or near reproductive organs, leading to inflammation, scarring, and adhesions that restrict normal organ movement. The pelvic muscles may also tighten in response to chronic inflammation, compounding the pain. For some women, the pain disrupts intimacy and relationships, often resulting in emotional distress, anxiety, or depression. Women may feel isolated as they struggle to discuss such a deeply personal issue. Importantly, the severity of pain during intercourse does not always correlate with the extent of the disease, meaning even minimal endometriosis can cause significant discomfort. If you're finding this content helpful and want to learn more about health and wellness, make sure to hit that subscribe button and join our community. Your support means the world to us. Number 3. Pain with bowel movements or urination. It is another significant yet often overlooked symptom of endometriosis, indicating that the condition may involve the bladder, bowel, or tissues surrounding these organs. This pain is usually more intense during menstruation, as hormonal changes exacerbate the inflammation caused by the presence of endometrial-like tissue outside the uterus. When the bowel is affected, women may experience sharp, cramping pain during defecation, which may be accompanied by constipation, diarrhea, or even blood in the stool. Similarly, if the bladder is involved, urination can become a painful ordeal, sometimes causing a burning sensation or urgency that mimics a urinary tract infection. These symptoms result from the irritation and scarring caused by the abnormal tissue, which can also form adhesions that bind organs together, restricting their normal function. The severity of these symptoms can vary, but often interfere with daily activities and significantly impact the quality of life. Number 4. Heavy or irregular periods. Menorrhagia and metrorrhagia are common and troubling symptoms of endometriosis, often signaling the presence of this condition. Women with endometriosis may experience periods that are significantly heavier or longer than normal, requiring frequent changes of sanitary products or even leading to anemia due to blood loss. Irregular periods, where the cycle length varies widely or periods occur unexpectedly, can also be a clue, caused by the abnormal hormonal fluctuations and inflammatory response driven by the endometrial-like tissue growing outside the uterus. These issues often result from the tissue's interference with the reproductive organ's function, such as the ovaries, where hormone production is regulated. Heavy bleeding can also be accompanied by large clots and intense cramping, compounding the physical and emotional toll. For many, these symptoms disrupt daily life, causing fatigue, discomfort, and difficulty managing routines. Number 5. Infertility. Infertility is affecting an estimated 30 to 50% of women with endometriosis. This occurs when endometrial-like tissue growing outside the uterus causes inflammation, scarring, and adhesions in the reproductive organs. These abnormalities can block the fallopian tubes, preventing the egg and sperm from meeting or disrupting ovulation by impairing ovarian function. Even when conception occurs, the altered uterine environment may hinder implantation. Furthermore, the chronic inflammation linked with endometriosis can damage the quality of eggs and embryos, further complicating the journey to pregnancy. For many women, infertility is the first indication of endometriosis and is often discovered during fertility evaluations after months or years of trying to conceive. Number 6, other symptoms. Fatigue, bloating, nausea, and digestive issues like diarrhea or constipation are often overlooked yet debilitating symptoms of endometriosis. Fatigue arises from the chronic inflammation and pain associated with endometriosis, as the body's immune system remains in overdrive, leaving many women feeling drained and unable to carry out daily activities. Bloating can cause noticeable abdominal swelling, often making women look several months pregnant. This is caused by inflammation and the accumulation of fluid in the abdominal cavity, a direct result of the body's reaction to endometrial-like tissue growing outside the uterus. Nausea often accompanies these symptoms, particularly during menstruation, and can be triggered by the same inflammatory processes. Gastrointestinal distress, such as diarrhea, constipation, or alternating between the two, occurs when endometriosis involves the bowel or pelvic nerves, further complicating digestion and causing significant discomfort. These symptoms are frequently misdiagnosed as irritable bowel syndrome or other gastrointestinal disorders, leading to delays in proper treatment. Let's now discuss some of the common causes of endometriosis. Number 1. Retrograde menstruation. Retrograde menstruation is one of the most widely discussed theories for the development of endometriosis. During normal menstruation, the uterine lining is shed and exits the body through the cervix and vagina. However, in retrograde menstruation, some of this menstrual blood flows backward through the fallopian tubes into the pelvic cavity. This backward flow carries endometrial cells, which can then implant on pelvic organs. Once implanted, these cells behave like the uterine lining, thickening and bleeding during each menstrual cycle, which leads to inflammation, scarring, and the formation of painful adhesions. Number 2. Genetics. Genetics is recognized as one of the key factors contributing to the growth of endometriosis. Studies suggest that women with a first-degree relative, such as a mother or sister, diagnosed with endometriosis are up to 7 to 10 times more likely to develop the disease themselves. This strong familial connection suggests that specific genetic variations may influence susceptibility. Researchers have identified certain gene mutations and polymorphisms linked to immune system function, hormonal regulation, and inflammatory responses, all of which play a critical role in the pathogenesis of endometriosis. For instance, some genes may lead to an overactive immune response, preventing the body from clearing endometrial-like cells from the pelvic cavity during retrograde menstruation, or may alter how these cells adhere and grow. However, the exact genetic mechanisms remain complex and not fully understood, as environmental factors, lifestyle, and other biological processes also interact with genetic predisposition. Number 3. Immune system dysfunction. Endometriosis is a complex condition with no single known cause, but emerging research highlights immune system dysfunction as a significant contributing factor. The immune system, which typically defends the body by identifying and eliminating foreign cells and abnormal tissue, falters in individuals with endometriosis. Normally, misplaced endometrial-like tissue outside the uterus would trigger an immune response to destroy it. However, in endometriosis, the immune system fails to recognize and clear this aberrant tissue. This dysfunction allows the tissue to implant, grow, and cause inflammation in areas like the ovaries, fallopian tubes, and pelvic lining. Moreover, studies suggest that individuals with endometriosis often have altered levels of immune cells and cytokines, leading to chronic inflammation and an environment that promotes the survival of ectopic endometrial cells. Adding to this, an impaired immune response may enable retrograde menstruation, resulting in viable endometrial cells escaping destruction and adhering to other organs. Number 4. Hormonal factors. These factors play a central role in the development and progression of endometriosis, with estrogen being a key driver of the condition. Endometriosis is considered an estrogen-dependent disorder, as the misplaced endometrial-like tissue found outside the uterus relies heavily on this hormone for growth and survival. In individuals with endometriosis, there is often an imbalance in hormonal regulation, leading to elevated local estrogen levels and reduced progesterone sensitivity in the affected tissue. This hormonal environment not only stimulates the growth of ectopic endometrial cells, but also exacerbates inflammation, which is a hallmark of the condition. Studies have shown that individuals with endometriosis may have altered enzyme activity, such as increased aromatase production, which converts androgens into estrogen, further fueling the disease. Hormonal factors can also disrupt the normal menstrual cycle, contributing to retrograde menstruation. These cells, under the influence of estrogen, attach to surrounding tissues, form lesions, and cause pain, scarring, and adhesions. The cyclical nature of hormone fluctuations during the menstrual cycle can worsen symptoms, as the ectopic tissue responds similarly to the uterine lining, thickening and bleeding with each cycle, but without an outlet for the blood to exit the body. Number 5. Surgical scar complications. Although this is a less common symptom, but is considered a recognized cause of endometriosis. Known as scar endometriosis, this occurs when endometrial cells are inadvertently transported to a surgical incision site during procedures such as cesarean sections, hysterectomies, or other abdominal surgeries. During these operations, tissue from the uterine lining can become embedded in the surgical wound, where it implants and begins to grow. Once established, this misplaced tissue behaves similarly to endometrial cells within the uterus, responding to hormonal changes during the menstrual cycle. This results in painful swelling, cyclic bleeding, and the formation of nodules or masses in the scar area. Patients with scar endometriosis often report localized pain that worsens during menstruation, as well as tenderness or a visible lump near the surgical site. The exact mechanisms behind scar endometriosis remain unclear, but it is believed that factors such as surgical technique, tissue trauma, and individual susceptibility to endometrial cell survival outside the uterus may play a role. While rare, this form of endometriosis highlights the potential for the condition to develop outside the pelvic region, challenging traditional notions of its origins. Endometriosis is a complex condition, but understanding its causes and symptoms is the first step toward managing it effectively. Whether it's immune system dysfunction, hormonal imbalances, surgical scar complications, or other factors, each piece of the puzzle brings us closer to better treatments and ultimately a cure. If you or someone you know is experiencing symptoms of endometriosis, don't wait. Early diagnosis and intervention can make all the difference. Let's continue to raise awareness, support ongoing research, and empower women to take control of their health. Thank you for watching, and remember, together we can break the silence surrounding endometriosis.